Okay, before we are going to talk about today's topic, I invite you to go through the previous lecture so you will able to understand properly. We are going to discuss about the invasive ventilator mode. Today we are going to discuss about SIMV mode. SIMV means synchronized intermittent mandatory ventilation. This one also there are two main mode, volume control and pressure control, same as the assisted control ventilation mode. There are also two mode. One is volume control, other one is pressure control. So what happen in the SIMV mode, we are fixing some amount of breath. For example, we can fix 8 breaths, 10 breaths, 12 breaths, like we are fixing the rate. Then rest of the breaths patient will be take by themselves, like the total breath count will be like 20 per minute, like will be there. So this is a mode of weaning off mode from the control mode. So some breaths machine will provide and some breath patient will take by themselves. So the problem with this mode is desynchrony, patient ventilator desynchrony, because patient also try to get breaths and machine also try to provide breaths. Because of these two people are work to do the same thing, there can be desynchrony and problems can occur. Now we are going to discuss about the pressure support ventilation or CPAP mode. In the pressure support ventilation, we are fixed the certain amount of airway pressure. So what happen when the patient is do the inhalation, if their breaths not adequate, what happen, there will be negative airway pressure generated in the tube system. This negative airway pressure which was generated in the tube system when the patient inhale will trigger the ventilator. So the ventilator will support that patient breath and provide the adequate tidal volumes. This is what happened in the pressure support ventilation. There is no breaths triggered by the ventilator itself. All the breaths will be taken by the patient. The ventilator just giving the support. Okay. Now I think you can understand three modes. First one, assisted control mode. We control everything. In SIMV mode, we are controlling some part and patient will take their breaths also. In pressure support ventilation mode, patient is the one who trigger all the breaths. Ventilator is just doing the supporting. So you can understand the support is gradually reduced, which is given by the ventilator. So in this way, we will going to wean off the patient who are in the ICU. Okay, then we will discuss what regarding the basic parameters. Initially during first lecture, I told you I will discuss each and every one in detail, so you can get a clear idea. We will go from bottom to top. No, I will take the easiest one first. What is the trigger? Trigger, you know, when we are discussing, now we are discussing about invasive ventilator now. So we are intubating the patient. There will be ET tube. ET tube will be connected to the ventilator through the tubing system. When the patient do the exhalation when the patient do the inhalation, those gases will pass through this tubing system. So what happen here, when the patient do the inhalation, you know, when we do the inhalation in normal environment, there will be negative pressure build up in our thoracic cavity, in the thorax. So the same thing happen in the tubing system also, because now this is a closed system. When the patient do the inhalation, there will be negative pressure generated in the tubing system. So by trigger, we are setting this level to which level the ventilator will be triggered and the breaths will be supported. I will explain this further. Okay, now just think. I told you that trigger should be around 2 to 5. If someone accidentally put a very high trigger, think 10 to 12 trigger someone has put, what will happen? Then the patient has inhaled so much and generate the very high negative pressure in the tubing system to deliver the breaths by the ventilator. patient has to like inhale very much to generate very high negative pressure. That is practically impossible someone to do, especially in a ill patient. So the breaths will be not provided adequately. What happen if we put the trigger very low, like 0, less than 2 values? What will happen? Then even the flickering of movement, patient is not generating breaths, but the ventilator will be triggered that he is trying to get the breaths, so I should support. So he will continuously support and the patient will be end up hyperventilating. So don't go to either of the extremities. The trigger should be around 2 to 5. I think you all are very clear. Next video I am going to discuss about other 5 parameters. So stay with the channel. If you have not subscribed still, please subscribe.